Welcome to New Self Technology's Medical Practice Management podcast series. I'm Lindsay Coates. Healthcare has started to embrace video technology, and here to discuss its impact are Tim Jones and Ron Pion. What are some ways that video is being used in healthcare?
Well, actually, it's been used in healthcare for a very, very long time for continuing education, for physicians, nurses, allied health professionals, and everybody who works in an opportunity to, to serve patients. What it is, I hope we'll kind of focus on today is why video as a media experience, capturing images, sounds, content, as we're doing right now, can be used both for the provider side, doctors, nurses, and other allied healthcare professionals, and the patient side. The question is how to use it well, where to use it, when to use it, and in general, how to take advantage of it.
You know, I agree, and I had that down in my notes as well, that it's been used for such a long time, but I think the difference now is the technology has finally gotten to the point where it's cost effective and it's ubiquitous enough that this communication between doctors and patients really can happen in real time. We don't have to travel and be at a specific video link-up place. The technology really is most of us are carrying it around in our pockets right now with our smartphones, and with that technology and what that does is just opens up the possibilities. And we'll get into this later, but I think we start to move beyond a passive experience of pushing information out to a real collaborative structure.
How has video impacted doctor-patient interaction?
Well, it depends, again, how it's being used, and Tim can talk to why a particular feature of television called animation helps, depending upon the viewer, to kind of get more involved interactively, because animation, as a rule, is more entertaining, and without entertaining somebody watching, then you're not engaging a mind. It's very important to engage a mind of a patient. For example, if he or she has just learned about a new diagnosis or is frightened of the words the doctor is using, doesn't understand them. And I wanted to distinguish between where a patient might be at the time he or she is viewing a program. Is it the office? Is it at home? Is it in a lab? So again, are defining in a very granular focus where it is that a patient is interacting with a screen, because interacting with the screen is what we want to accomplish. And we can take specific examples in a moment so that you can drill down with us, Lindsay.
And Tim, how would you say it's affecting patient care?
One of my favorite quotes from George Bernard Shaw says, "The single biggest problem in communication is the illusion that it has taken place." And so I think when we think about that and think about the communication and the doctor says, well, I told the patient, and yet there's a divide and there's a miscommunication in some way. But I think what we're seeing is ways to improve this communication, that we're not now limited to those precious few minutes between the actual FaceTime of the doctor and the patient. The opportunity for communication becomes a lot more broad and a lot more ongoing. So we're moving from a very limited time, a face-to-face time, and for all intents and purposes, a print medium, take this pamphlet home or read this information, to an interactive communication platform and a video form of communication that engages the mind, as Ron said, in many different ways, and helps that communication and helps the understanding and betters the relationship between patient and doctor.
What are some of the benefits that patients are getting out of video use?
The benefits that we're seeing, I think, break down into two big buckets. First of all, we talk a lot about literacy and health literacy. The Institute of Medicine Committee on Health Literacy suggests that over 90 million U.S. adults do not have the literacy skills to access and use the U.S. health system. One of the reasons that we think that video, and in particular animation, is impactful is that we address that. So we use non-written forms of communication to help that process, to get over the basic literacy issues. But beyond that, the other big bucket that we talk about is engagement. Gartner just did a recent study, talking about video and being able to deliver information and emotional impact, and it sort of broke that down into 4 key areas. So engaging interests and delivering details was by far the most impactful use, and the reason that video is being used. It also increases credibility, it triggers empathy, and it alters mood. So those are a couple of the big things and a couple of the big benefits that healthcare consumers and patients really get from video that they aren't getting in other forms of communication.
Each of us has a different way of learning. Some love to read and learn. Some love to listen and learn. Some love to watch and listen and learn. And what we're talking about here is, how do you use media generally? And I think there has been an underutilization to date of having patients understand and communicate with their physicians and other healthcare providers. And Tim has come up with what he knows and he has learned, and that is that animation, for example, is a wonderful way of learning, not for the young only, because, my mom took me to see Bambi and she cried just like I did when we were watching.
So how do you foresee medical practices using video in the future then? Is it going to be on a grander scale, more often?
If I had my way, I would make sure there was a large screen in every physician's office, and making sure that doctors and nurses and allied health professionals and business people, that the office itself works as a unit. But it's really also a question of our identifying from the folks in the office, what is it that they need to learn? Do they need to learn to be more customer-centric, patient-centric? Can they schedule better so that people don't have to wait in the office for 45 minutes and get angry? Can they also see to it that whatever it is that brought the person to the office in the first place is being responded to, and the person leaves the office with a better understanding, or will watch video at home on his or her own screen or on a DVD that the doctor has provided, and then the whole family can sit and kind of watch it and understand.
Healthcare is a little bit behind where sort of the mass consumer is right now. And as we've seen over the last sort of 10 years, as we've moved from a Web 1.0 world into a Web 2.0 world, so goes healthcare. And we will see that video will become more personalized, more interactive, more ubiquitous, not only in the doctor's offices, but on your laptop, on your tablet, PC, on your smartphone. We'll see more care management, adherence, did you take your pill, reminders of all sorts of things that will become more and more personalized to that individual patient. So I think video and a lot of this technology will increasingly enhance the communication between doctor and patients.
Well, excellent. Well, I really appreciate you both being here today. Thank you so much.
Well, thanks for the invitation. It was great. We really appreciate it.
Clearly video's going places with the millions and millions and millions of views that are going on a daily basis. I'd just like to remind everybody that this is part of a 3-part series, and that we are also going to be covering mobile technology and patient portals. So be sure to check those out as well. Thanks again, guys. And this has been Lindsay with NewSoft Technologies. Have a great day.